And I'm up and recording is in progress. I want to welcome everybody. I'm thrilled to see this many people that are interested. We are going to continue along these lines in a couple of weeks. As soon as I get a confirmation, NDSC will come in because we feel like things are happening so fast. We're trying to keep y'all updated and educated. This is something that DSAA and GG's is working together to make sure that y'all are staying on top of what's going on. And as we all know, it is moving so fast. There are a couple of things that I want to remind y'all about. Of course, this is a big month for us, so please stay tuned to what we're doing and what GG's will be doing. But more importantly, coming up is next week, we have an amazing conference for y'all. Put on by Emory. We have 4 national leaders in the field of in the medical field for people and specifically for Down syndrome. By the end, or if maybe Denise can put in the link or the chat, a link to it so y'all can see who's coming. But please don't miss this opportunity. We're bringing it right to y'all and putting it right in your laps. Very much like what we're doing with Kevin and bringing the National Down Syndrome Society right here to you. So we're hoping that Kevin is going to be able to answer those burning questions that we all have right now. If y'all should have any questions, so Denise has put that in the link. Please check it out and please sign up. I don't want anybody to miss out. But if y'all have questions tonight, Kevin, do you prefer that people wait for questions? I can read it. I can read the chat, but do you prefer that people wait till the end for questions, or are you okay with them asking throughout?
I have, so there's 3 main sections tonight, so I'll stop after each section to answer
Okay.
questions.
Perfect. Okay. If y'all want to turn your camera on, great. But if you don't, I understand that too. But I personally like to see faces. But if you don't want to, you don't have to. So without further ado, I want to introduce my friend Kevin from the National Down Syndrome Society up in DC. And I literally, when I spoke to him today, he was on Capitol Hill. So he's moving. And welcome, Kevin. We're so thrilled to have you. I'm
Thank
also
you.
very proud. There are really no other DSAAs doing this. And so I think that says a lot about who we are as a community and how hungry we are for the information. So that makes me very proud. So thank you, Kevin, and go ahead.
Thank you for having me. All right, I'm going to share my screen. Oh, give me 1 second. Okay, now it's asking. Hold on. Okay. This is always gives me an issue. Okay. Can you guys see my screen?
Yes.
Yes.
Okay. Okay, I'm going to go into presenter mode. I'm not tech savvy, so there we go. Okay. So thank you guys for having me. I'm super excited to talk to you guys today and give you a little update on what's going on at the federal level. If you watch the news or use social media, I'm sure you're aware that DC has a lot going on at the moment, and it can be very confusing. So I'm here to give an update on what I'm hearing from leaders on Capitol Hill, from my colleagues, and from research I've done myself, and to answer any questions. So like I said, my name is Kevin. I'm the manager of federal government relations at the National Down Syndrome Society. I primarily work on education and employment policy, but given the focus on health policy that Congress is focusing on right now, I've been jumping into help with our health priorities. And I've been with NDSS for 7 months, and I've loved every single moment of it. I love meeting people in the community, and I'm super excited to be here. So this is our agenda. I'm going to start with some legislative updates, what's going on Capitol Hill. We'll talk about budget reconciliation and the potential cuts to Medicaid. I'll then talk about the Department of Education. This has been a big talking point for the administration so far since January 20th. So we will talk about the executive orders and action being taken, and also an update on Secretary McMahon's confirmation process. And then I'll finish by covering just a little bit on the Section 504 lawsuit, the Texas v. Becerra, and just giving an update and making sure we're all on the same page. So I'll get started with legislative updates. So this is what's going on Capitol Hill. This is your House of Representatives and your senators. And we are going to start by talking about budget reconciliation. So this is a special legislative tool that Congress uses to pass legislation that deals with how much money the government spends or how much money they bring in. So this is a way to pass priority tax legislation regarding the budget, and also raising the debt limit. This is used primarily when one party is in control of the House of Representatives, the Senate, and the White House, because it's a way to really advance your priorities very quickly. This has been used a number of times over the last few decades. Most recently was done in 2021 when the Democrats had power of all three. This is special because in the Senate, to pass a budget reconciliation, you only need 51 votes. You cannot use the filibuster. The filibuster is when a senator puts a hold on a bill and then requires 60 votes to get it to pass instead of the simple majority of 51. And also there is a limited amount of amendments you can add. So this is when senators will add on different pieces of different legislative priorities onto a bill. So senators and representatives are not able to attach as much to budget reconciliation. This is also a process that can be used to cut mandatory entitlement programs. And when I say mandatory entitlement programs, I mean Medicaid, I mean SNAP. So that's like food stamps and Medicare. One important thing to note is that Social Security is usually not touched in the budget reconciliation process. The Senate has a rule about not touching Social Security when doing budget reconciliation, unless 60 senators agree to take up legislation. So Social Security is pretty much off the table when it comes to budget reconciliation. This is a little bit on the process. Again, the process is super confusing. Me and my team are constantly double checking what's going on. Even members and their staff are confused because it's a confusing process. So basically it starts by they have to pass a budget resolution. And so both chambers have to do this. So the House and the Senate have to pass a budget resolution that tells each of the committees in Congress how much to cut or how much to spend in the budget reconciliation process. We are currently in the middle of step one. On Tuesday night, the House of Representatives passed a budget resolution, and I'll talk more about that on the next slide. And what we're waiting for now is the Senate to pass their budget resolution. In order to move on to step two, the House and the Senate have to agree on how much to cut or how much to spend. So after they agree and both chambers pass the budget resolution, each of the committees has to draft legislation on how to meet the number that was decided in the budget resolution process. So for example, again, I'll talk about this on the next slide. The committee that is responsible for Medicaid in the House is the Energy and Commerce Committee, which is very confusing, but it doesn't make sense with the name. But the Energy and Commerce Committee was directed to cut $880 billion. So the Energy and Commerce Committee will now, once the Senate passes their version and they have an agreed number, they will draft legislation to make that happen. Once the committees write their legislation on how to make these cuts or increases, they send it to the Budget Committee and they put all the committees' different bills into one big bill. That's usually really, really long. And then that bill goes to the full House or Senate floor where the members vote on it. Again, you just need a majority in the House, so you need 217 votes, and in the Senate, you just need 51. If there are differences in the bills, which sometimes there are, then members of the House of Representatives will meet with members of the Senate, and they'll hash out the differences, and then the final bill is voted on once again, and then it's sent to the president to be signed. So it's a long process. It's super confusing, and you probably won't understand it after tonight. And we're always happy to answer questions as well. But all you really have to know is right now we're in the middle of step one. So I'll talk a little bit about what's currently going on with budget reconciliation. On February 25th, so Tuesday night, the House of Representatives passed a budget resolution. It was a very close vote. They voted along party lines. Every Republican except one voted yes, and every Democrat voted no. In this bill, it directs the Energy and Commerce Committee, which has jurisdiction over Medicaid and other healthcare programs, to cut $880 billion by fiscal year 2034. And so this puts Medicaid at risk. $880 billion is a huge number, and it really seems like there will be Medicaid cuts so that they can reach that $880 billion. The next step, like I said, the Senate has to agree to the same numbers. We don't believe that the Senate will agree to the numbers that the House put out. So we think this $880 billion might be lowered, but only slightly. And we're still quite concerned with it being lowered even a little bit to what the Senate might want. So I'll talk a little bit about Medicaid, and I'm sure you guys are all familiar, so this might be a little bit more digestible than talking about budget resolution, but as hopefully you all know, Medicaid is a joint federal and state government healthcare program. So this means that the federal government and the states are both responsible for funding Medicaid programs. This is the primary insurance for individuals with disabilities, and it's also the primary insurance for individuals with Down syndrome. It allows access to specialized services that sometimes in private insurance companies won't cover. It also provides funding for home and community-based services, which is an optional service under Medicaid, but we all know HCBS is such a lifeline for our community. It allows individuals with Down syndrome to have access to care within their own home. And it also provides funding for services in schools. So Medicaid will reimburse schools for services like speech therapy, occupational therapy, and physical therapy. Oopsies. Again, just hammering on the point of home and community-based services and how important they are. They help 4.5 million people with disabilities get care in their homes and to stay in their community and not have to go to a nursing facility or even, worse, what used to happen decades ago, go to institutions. HCBS makes up on average 37% of state Medicaid budgets. So there's obviously a huge need for HCBS. And luckily states are providing it, but not enough. As of January last year, there were over 7,000 people in Georgia on the HCBS waiting list, and this is not uncommon in other states. Waiting lists are incredibly long. They take years for people to actually get off of, and then to have access to these home and community-based services. It's also important to note that these are optional services. So states are required to provide certain services under Medicaid, but then they're also able to provide optional services using waiver programs. And so when there's less money going to Medicaid and states have to cover more of the cost, optional services are the first ones that'll get cut. So these are some of the proposals that we're hearing, and I want to mention there has been no legislative text that's been introduced to cut Medicaid. What we're going off of is conversations we're having on Capitol Hill. I was on Capitol Hill all day today talking to members of the Republican Party, their staff, but also directly to members about potential cuts. And we also look at what has been proposed in the past. There was a huge fight to save Medicaid back in 2017, right around the beginning of Trump's first administration. And we expect that some of those proposals that came out to cut Medicaid will be introduced this time around. So the first two I want to talk about are block grants and per capita caps. So right now, Medicaid funding, the states share the cost. So states that have higher healthcare costs or higher costs to administer Medicaid actually get more money from the federal government. As of January of this year, 2025, the federal government was paying for 66% of Georgia's Medicaid program. And then Georgia was making up the remaining, what would that be? 36%, 34%. And so what is being proposed and what has been proposed and what's been talking about being proposed are block grants or per capita caps, which is a fixed amount that goes to each state. It doesn't matter how much it costs for a specific state to run Medicaid. Block grants would be just one flat number that goes to states based on how many people they have. and per capita caps would be similar. It's a fixed amount for each enrollee. So this would mean that states that typically get more assistance from Medicaid would be getting less in the future. So states like Georgia that get 66%, states like Mississippi that's the highest, gets the most amount of assistance from the federal government, they would get less money for Medicaid. And so in order to deal with getting less money, some states would have to cap enrollment, they'd have to cut optional coverage like HCBS, they'd have to reduce health benefits, the potential, the scope of benefits you can access under Medicaid would potentially be reduced. And then they'd have to lower payments to healthcare providers. So providers that take patients that use Medicaid would be getting less money. And so these all are not things we want to see happen at all. We think that Medicaid should still be, the federal government should be providing more funding to the states that need it the most, like Georgia, instead of limiting that amount, because it'll have a negative effect on our community. Oopsies. We're also hearing about work requirements, and this has been proposed a few times in the past, and it would require Medicaid recipients to work or to volunteer or to do some sort of a job training program for a minimum number of hours a week or a month. Past proposals have had 20 hours a week worth of work volunteering or job training. Some have been, so it's usually 80 hours a month or 20 hours a week. You'll hear members of Congress talk about these proposals, and you'll say that they want this for able-bodied adults. They want able-bodied people that are on Medicaid to have work requirements. However, the exemptions in the past that have been written for people with disabilities always say deemed unfit for employment or deemed unfit for employment by a medical provider. And we are concerned about this language. We know that people with Down syndrome are not unfit for employment. We have 5 staff members at NDSS who have Down syndrome and work, and they are not unfit for employment. I'm sure there's people on this call with Down syndrome who have jobs and are not unfit for employment. And so this would require individuals with Down syndrome to either go to their state Medicaid program and say, I am unfit for work, which would be reinforcing negative stereotypes, and also wouldn't necessarily be true, or it would require them to adhere to this 20-hour a week or 80-hour a month minimum. But when that happens, their income increases and they might lose access to Social Security or other federal benefits that they receive. So we're really concerned about these work requirements. We've also seen it in Arkansas and also in Georgia. I know Georgia has the Pathways program for individuals that would be covered under Affordable Care Act expansion. What we've seen is that it doesn't increase employment opportunities, it decreases health outcomes, and there's more of an administrative burden. And so people that need healthcare are losing coverage because they can't get through all the red tape. And that's really unfortunate. So this is something I've been talking about with many members of Congress, many staff members, letting them know that work requirements are not ideal. And if work requirements are going to get passed, we need stronger exemptions for individuals with Down syndrome and other disabilities as well. Because we don't want someone to have to lose their benefits just so that they can keep getting Medicaid. And we don't want people to have to go to the government and say they're unfit for work, because that really is that's taking a step backwards. So we have some options on how you can get involved in advocacy. We have created a toolkit and an action alert that's linked here, and hopefully the slides will be sent out afterwards, and you can use the links, and if not, I'm happy to send them to Cheryl and she can send out our action alerts. But this toolkit is great. It was made by my team at NDSS. It explains what Medicaid is it explains what the potential cuts would do to our community, and then it takes you to a system we use called Quorum, where you put in your address, and then it automatically will address the letter to your 2 senators and your member of Congress. And you can also add in, we have preloaded language in there about why Medicaid is important. And then there's also a space for you to share your own story. And we really love when people share their own stories. Even today, I was able to, I ran into a member of Congress and I was able to tell him a constituent story that someone used on our, shared through our action alert. And I was able to get that story directly to the member, and he responded very positively to it. And so it's a great tool. And it's a great tool for us to track how many advocates are reaching out to their members. Our message is clear. Medicaid saves lives. It allows people to stay in the community, and it needs to be protected. And if we impose cuts on people, we're taking a step backwards, and that's not what we need right now. So that's Medicaid. You can take a deep breath because it's quite confusing, and I'm happy to answer questions. And you can either put them in the chat or raise your hand. I'm good with either layout.
Y'all, this is a time to ask questions because I will tell you that I think that I'm sort of in the know, and I'm as confused and alarmed, as I think all of you are.
I
I
mean,
sat in a meeting
I
last
have
week
a
with,
kind of a question, but it's more like I don't know. It's it. So I mean, because I know we've been sending letters and people have been calling and going to see our representatives, but how much? I'm not trying to be negative, but I mean, how much can we influence? Our senators are might probably already vote no for these changes, but how can we get to you know the other senators that are not Georgia senators that will the Republican ones that will vote for this.
That's a
I
good
mean,
point. That's a really good point. You guys in Georgia, you have two Democratic senators who I don't believe would be supportive of cuts to Medicaid. They're actually both members of the Down Syndrome Congressional Task Force, so they've been very supportive of our community. But Georgia is still one of those purple states that has a lot of Republican members of the House of Representatives. And that's where this bill currently is right now. And so if you are sending it just to members that have said that they don't support cuts to Medicaid, it's still important to share your story. Our action alert directs people to their members of Congress because it's most important for members to hear from their constituents. The constituents are really the employers of the members. The members work for you. And so we think it's important to share those stories directly. But if you feel so inclined, you can call any member of Congress and you can voice your concerns. It doesn't just have to be from your state. With our action alert, we prefer to have it just be constituents reaching out to their members. But I think it still is important to reach out to any member and share why Medicaid is important and shouldn't be cut. And I know it's easy to don't feel like you're being negative. It's very easy to feel like you're being negative. It's also important to just take breaks and deep breaths, and so don't ever apologize for feeling that way. I get like that sometimes too, and I'm in DC and do this every day.
it's important to tell your story. Not to say that my story and Howie's story isn't a great story, but it's important to tell your story. And so that's why we can't always be the ones talking for y'all. We can certainly talk in the end about the toolkit and action alert are excellent. About are excellent tools to kind of get you into the groove and understand that it's not as daunting as it might seem, and they need to hear from you.
And then I see
There were a couple of other questions.
Yeah. I see the one on the time frame about the process in the first slide. The Senate is still working to finalize their budget resolution. They are also going through the process of confirming all of Trump's nominees to lead different agencies. We expect that to be done in the coming weeks, but I think sometime towards the end of March or beginning of April, I think we can probably will be able to see Senate numbers. And then by the end of April, I would see maybe the House and Senate coming to an agreement. But again, it's very hard to predict what Congress is going to do. They move on their own schedule, and you have to be very reactive in the world of politics. But for now, I think the Senate has to go through these confirmation hearings and votes, and that's taking up the majority of their work. Once that's done in mid-March, I think we'll start to see their budget resolution numbers. So there still is plenty of time to influence and to advocate. I'm seeing a question about the now and the comp waivers. This is Georgia specific, so I am going to pass on the question because I don't want to give you wrong information. Most waiver programs are optional services, so it's just like what I said with HCBS. It's with less funding, states might end up cutting access to waivers.
So I do want to say that Charlie Miller, for those of y'all that were with us a couple of weeks ago, Charlie Miller from the Georgia Council on Developmental Disabilities is back. So Charlie, do you mind, Kevin, if he steps in real quick?
Yeah,
Charlie,
of course.
make it a short one, Charlie, because I want to give Kevin time to
You-
finish.
You do realize I'm the son of a car salesman. I can never be short on
I
things.
know. That's why I
Um,
said short, Charlie.
But yes, nail and comp waiver would be highly affected by these cuts in Georgia. As Kevin said, we have 7,000 plus waiting list currently in Georgia, and the state legislature gives us very little in funding for these. Keyword here is optional services. They technically don't even have to fund any of it. Um, uh, so reaching out to your legislator, and I'll keep this short, but I will also say, if you're concerned about these cuts, reach out to your legislator. Um,
Your legislator here,
yes,
your state
in
legislator.
your state legislator, because they also can talk to their federal folks and say, hey, I'm in, Vidalia, Georgia, and I have concerns about these cuts to our community.
Fully agree. And thank you for providing that context. I'll answer Marion's question, and then I'll move on just for the sake of time. But you can be reaching out as much as you want. You can use our advocacy alerts multiple times. I think weekly is not pushing it at this point. Like I said, this is a lifeline for our community, and it's important that they continue to hear from us. If you want to do it daily, no one at NDSS is going to stop you. But I think continued outreach is, I would say, once a week if you want to fill it out. It's very quick if people have done it before. And same thing goes for phone calls if you want to call the office as well. Sometimes you'll get an intern on the phone that'll just take down your note, but calling members does work, and the messages do go back to the members. I used to be an intern on the Hill and had to answer those phone calls. So it does truly go back to the member no matter what people say. And then Linda, just for the sake of time, if you don't mind holding your question to the end, I'd be happy to answer it, but I want to make sure we have time to cover education and 504. So that's Medicaid. Now move on to the Department of Education, which is more in my wheelhouse, as I do more education policy. And I will give an update on Trump's pick to be Secretary of Education, Linda McMahon. She was confirmed by the Senate Help Committee, that's the Health, Education, Labor, and Pensions Committee, last week on full party lines. Every Republican voted yes, every Democrat voted no. The full Senate had a vote today. The full Senate does a lot of fancy procedures. They had a full vote today to advance her to have a full vote on Monday. So on Monday, there will be a vote where all of the senators, all 100, will vote to confirm Linda McMahon as Secretary of Education. After that, she'll be sworn in at the White House, and then will take her role as secretary. During her hearing, McMahon discussed a lot of different things. And one of those things was moving programs from the Department of Education to other agencies. And this is something I'll talk a little bit about in the next coming slides. She also voiced her support for school choice and voucher programs. And again, I will cover that as well later on, but her hearing was one of the less contentious ones. I know with some of the other hearings, there's been not screaming matches, but it's gotten a little intense. This was one of the calmer ones that I watched. So I'll talk a little bit about what the Department of Education does. Within the Department of Education is the Office of Special Education Policy, which is responsible for distributing grants and then also ensuring that states are complying with the Individuals with Disabilities Education Act. IDEA was passed in 1975. This is the 50th anniversary of IDEA. It's a huge year for our community. and it provides students with disabilities access to a free and appropriate public education in the least restrictive environment. This is the language that's in the bill text, and it ensures that students with Down syndrome and other disabilities are able to learn in the best environment for them. And so how the funding works is states basically calculate how much it costs for them to provide special education services to students. They count up how many students with disabilities they have that are eligible under IDEA, and they report that number to the Secretary of Education. And then the Secretary of Education talks to Congress about how much money Congress should give to fund special education. And that is done every year through the budget process. And then once the budget is passed, the money goes to the Department of Education, where they give out these grants so that states can provide special education services. It's important to note that when IDEA was passed 50 years ago, it required that the federal government would pay 40% of special education funds. This has never been met in its 50-year history. On average, it's between 10 to 15% is what the federal government pays. And so this is another policy priority for us that's separate of all of this, what's going on at the moment. It's the IDEA Full Funding Act. It's also important to mention the Department of Education does not set curriculum, and it does not set teacher certification requirements. That's up to state and local education agencies. The department was created to ensure an equitable access to quality education for all students, and that's what the department continues to do to this day. We are anticipating an executive order to be signed in the coming weeks. And we expect the executive order to direct the secretary, so Secretary McMahon, to write a report on how to best dismantle or abolish the Department of Education. This was a campaign promise for the president. It's also been a campaign messaging issue for Republicans, and it's something that Republicans say they want to give education back to the states and have less federal oversight. And so we expect that this executive order will come once Linda McMahon is confirmed and sworn in. We actually thought it was going to come a few weeks ago, but Hill staff was able to tell the White House to push it back until McMahon was confirmed. So when she's confirmed on Monday, we can expect it shortly after. It's also important to note that abolishing a federal agency does take an act of Congress. And during her confirmation hearing, Linda McMahon did say that she will work with Congress to work on dismantling the department in some capacity. She mentioned that IDEA oversight could potentially be moved to the Department of Health and Human Services, so that's HHS. This is something that's concerning to us at NDSS because we think that special education programs should be overseen by people with an educational background and not through an agency that's focused on health. We want IDEA and the oversight to be focused on the educational outcomes for the children. And we're worried that if this moves to HHS, there'll be more of a focus on the health of students, and this would be a step backwards. We're also concerned within the department, there's the Office of Civil Rights, OCR, which is responsible for kind of taking when people have an issue or face discrimination at schools, they file a claim or a complaint that goes to the Office of Civil Rights. And those claims are reviewed by education experts. They're reviewed by decades-long civil servants who have been at the department for years. And Linda McMahon discussed moving OCR to the Department of Justice, which just doesn't have the institutional knowledge that the Department of Education has. And so this is something that's just concerning to us. We think education programs should stay at an agency that's focused solely on education. There's also been a couple other executive orders that have been signed by the president that deal with education. The first one is Defending Parental Rights and Educational Opportunities. That's the name of the executive order. It directs the Secretary of Education to issue guidance and also to promote school choice and voucher programs. This is something we are monitoring at NDSS. We think that students should be able to attend schools that best fit their needs, But we also think that if they're going to a private school, they should have the same protections that they have at a public school. So this is something we're working on internally. We're not doing a ton of advocacy on school choice as of yet, but something we are actively monitoring. There also was a big executive order signed on Trump's first day in office that has been in the news frequently. It's the Ending Radical and Wasteful Government DEI programs. It directs all agencies to stop funding for programs considered to promote diversity, equity, and inclusion. As a result of this executive order, we've seen staff layoffs at the Department of Education. So we've seen already a reduced capacity at the department. So this means less people ensuring oversight to make sure that states are providing a free and appropriate public education to all eligible students with disabilities. This means less people at the Office of Civil Rights to resolve these claims and ensure that students with disabilities are not being discriminated against at schools. It's also resulted in canceled contracts. There have been 169 canceled contracts through the Institution for Education Sciences. Many of those contracts were for research to be done on how to improve special education. So it provided special educators with new tools on how they could provide a free and appropriate public education to students. And so we've already seen some cuts at the department already before this anticipated executive order. NDSS is waiting until we see a final executive order from the White House on an executive order to dismantle or dissolve or abolish the Department of Education. We're working on tools so that we can get it out immediately once an executive order is signed, but we want to make sure that the information we're giving you is on what's official from the government and not just from hearsay or gossip. And it's not gossip, but just conversations we're having with colleagues and members of Congress. We get our information from reliable sources. We are 99.9% confident that that's what the executive order is going to look like. It's going to tell the secretary to write a report, but we don't want to put out any information until it's official from the White House. And so as soon as there is an executive order signed, we will be posting about it. We'll have an action alert and we'll have a toolkit for you guys to talk to your members of Congress and tell them that special education programs should stay in the Department of Education. So that's education stuff. Again, happy to answer questions in either format. So yeah.
There should be questions now.
Kind of, yeah.
You're still going to talk about 504, right?
Yes, that's the next and the last section.
Okay.
Okay.
Charlie, did you have anything to add about Georgia specific?
Kevin, you're gonna like hate me after this evening. But so Georgia is currently in the almost at the end of their legislative session in Georgia, and we actually have been tracking a legislative bill that is, as they put it, they want to be proactive rather than reactive if there is a change within the educational field, and something gets abolished eventually. So I'll just read the text that I have. Um, uh, so Georgia Senate has just passed a bill, and again, it has to go through the House as well, saying that any teacher that is currently teaching in schools will be recognized by the state as a quote qualified teacher. This means that there will be some type of certification requirement for anyone wanting to teach within Georgia. Um, Again, the way that it's sounding, it's more of they want to be proactive than reactive at the end of the day. And so that's kind of an interesting place that the Senate is kind of posturing. That being said, the House could not pass that bill, and it could possibly die. So, just want to kind of give that a heads up.
Okay, Good to know. Thank you. Anything else from anyone before we move on? And if you don't want to ask questions in this environment, I will also share my email at the end of the presentation. So I'll give it a couple seconds and then I'll move on.
I have a question.
Thanks.
Go for it.
So it obviously this is all hypothetical at this point, but like if they do away with DOE and IDEA is moved to, goodness, it's all these acronyms. It's to HHS, right? How in danger is IDEA for our kids? Like, you know, I have a kid in middle school. So like how in danger is her schooling and education? Like yeah, if this all happens.
Yeah, I think IDEA is federal law. It's Part B of IDEA that funds special education services for students with disabilities aged 3 to 21 is it's permanently authorized. So Congress has to appropriate money for it every year. So money will continue to go to special education programs within the states. What we're concerned about is how much oversight there will be. And so if your child has an issue in their public school with accessing a free and appropriate public education, we're concerned that the federal government will be less responsive to any complaints that parents have or that students have in accessing that free and appropriate public education. And for two reasons. We think moving it to a health-centered agency is not the focus. We want to be focused on the educational outcomes of our students. But we're also seeing mass layoffs at the federal level. And we're concerned that with just less staff, there's going to be less oversight. And that's a huge concern because states are already not perfectly complying with IDEA. And the federal government is doing their best to ensure that this isn't the case, and they're working to provide technical assistance to states that are having issues. But taking away staff is something that's also a huge concern for us. So I think funding will still continue to go out. We're not trying to say that IDEA is going away at all. If the Department of Education is dismantled, that's not the case. We're just concerned that any issues that students are having won't be resolved in a quick enough manner. If that helps.
I have a question.
Mhm.
I do have a question. Okay, so we already know that least restrictive and IDA, well, I can never say those, but anyways, we already know they're not working 100%. Only because I have fought the fight. I do have a special needs grandchild that they are struggling with. And I have two daughters that are teachers in Cobb County, and they're already feeling this. The teachers are feeling the impact of what's going to happen or what they think is going to happen. And my question is, what's going to happen to these children that do have special needs in the classroom? Are they going to try to shift them all now to special schools and keep them out of the regular class? Because that has always been a fight.
Mhm.
And it doesn't always work because they are always pushed out at a certain grade into a small group.
Yeah.
They're parents are talked into it.
Yeah. And I mean, it's like I said, IDA is not perfect, and it's not the way it's implemented is not perfect at all. I think what we're worried about is in certain states, there'll be less requirements for them to adhere to with this federal funding that they're receiving. So we've seen it in Oklahoma that they've already taken part of their special education budget to pay for other areas of education that are not special education related. I've heard from families in North Dakota who have heard of proposals to open up special schools for individuals with disabilities. And so I think as just also what we're worried about with with it moving to another agency is that these requirements will be they'll be relaxed. There'll be less requirements for states to adhere to provide special education. And then it'll allow state governments to pass legislation that could potentially segregate students with disabilities even further than they're already being segregated, or also take away funding to use to pay for other programs that state governments want to provide. I think it's a moment of waiting and seeing what's going to happen and being prepared to tell your story, and the importance of inclusion for students with Down syndrome and with disabilities. And I thank you for, you said you've fought the fight and you continue to, so thank you. And thank you to your daughters as well, for being teachers. We need more teachers. I
Mhm.
think we're
We do.
we're concerned that states will be able to pass legislation to really change how special education is provided to students with relaxed regulations, if it's moved out of the Department of Education. So I wish I had a more concrete answer for you of what's going to happen.
Mhm.
I wish I had something that was a little more, not as gloom and doom, but it
Well,
is
I
reality.
did feel like it's a step backwards. What can possibly happen is a big step backwards,
Yeah,
and
sure.
it's going to be hard to climb up again, climb
Yeah.
back up. So
Yeah, I agree. And at NDSS, we're here and we're always willing to help you advocate, and we're also willing to advocate for you on the federal level. So we just encourage you to keep talking to us about your concerns, because we hear them and then we take them with us when we go talk to legislators. I do want to move on just because it is 8:50 and I want to talk about 504, if that's okay. I'm sorry, Sabrina. But I will move on. Just the 504 section's a little shorter, so I will have time and I can stay on for a couple minutes after and answer questions. But I'm going to talk about the 504 lawsuit. I know there's been a lot of questions up in the air, and hopefully this provides a little more context from what I'm hearing, from a federal level and from a level that's outside of a state that's involved in this lawsuit. So Section 504, as I'm sure most of you are aware, is a law that prevents discrimination for individuals with disabilities. It protects people with disabilities from discrimination in programs that receive federal funding. So this includes schools, but it also can include hospitals. It can include doctors' offices. It can include transportation. It includes federal jobs or jobs within the government at any level, state or local. You cannot discriminate against a person with a disability. 17 states have brought a lawsuit to the federal government, they're seeking to strike down a new 504 regulation that was issued by HHS during the Biden administration back in May 2024. However, we've seen on page 47 of the case is where they have the demands for relief. This is what the 17 states are asking the court to do. And one of those demands for relief is that they're asking to declare Section 504 as unconstitutional. I have, before I go on to that slide, this is a screenshot directly from the lawsuit. As you can see, Section D and E. Section D, declare Section 504 unconstitutional. Section E, issue permanent injunctive relief against defendants, enjoining them from enforcing Section 504. This basically means that the defendants won't have to enforce 504. And again, this is a screenshot directly from the court case. So as I'm sure most of you are aware, Georgia is one of those 17 states. And so we have had an action alert. I'm sure a lot of you have filled it out. We've gotten many people from Georgia filling it out and also commenting on our socials what they're hearing. But we're hearing that state attorney generals and also other elected officials are saying that they don't have the intention of declaring Section 504 unconstitutional or taking away Section 504 or taking away these really crucial protections for individuals with disabilities. And so we've heard it continuously directly from attorney generals, from their press offices, and from other levels of elected officials. There was an updated filing on February 19th, where the courts clarified that they want to just repeal the Biden guidance, and that their goal is not to take away Section 504. However, those demands for relief are still listed in the lawsuit. These demands for relief, Section D and Section E, that say declare Section 504 unconstitutional. We're worried because these are still in the lawsuit, and we're also hearing that state attorney generals are saying that groups like ours are spreading misinformation. I looked directly at what directly what the states filed, and I took it. I don't think that's counted as misinformation. I am glad to hear that a lot of attorneys general do not want to take away Section 504. And so the court case is currently on pause. It's being led by Texas. Texas's attorney general, and it's on pause as they're waiting to see kind of what the Trump administration is doing on a federal level. And so we hope that if it is unpaused, we hope that these two sections in the demand for relief are removed. We do not want Section 504 to be removed. These are crucial protections for our community. And it's really important that they stay in place, and also that states and the attorneys general understand what they signed on to. We've heard from state attorneys general who said that attorneys general, it's always confusing, who have said that declaring Section 504 as unconstitutional was never the goal of the lawsuit. That makes me worried, because that means, you can see it right here in front of you guys. It means they're either not telling the truth to their constituents, or they didn't realize what they signed on to. So while the court case is paused, it's still really important that you continue to advocate on the importance of Section 504 and why these two demands for relief should be removed from the lawsuit. Like I mentioned, we have an action alert created, and as I mentioned before, you put in your address. This will direct it right to Georgia's state attorney general. You can see you guys are one of the yellow states shaded. Those are the other 17 states. So we're really working to have people in those states fill out their action alerts and continue to, even if they've done it already. Like I said, when I answered earlier, if you've done it already, feel free to do it again and do it again the next week or the next week. But it's just really important to continue to share why Section 504 is so important and why it should not be involved in this court case at all. And I think most attorneys general would agree with you. That's what we're hearing. They like Section 504. They don't want to take away these protections. It's just important that we make our message heard so that these two demands for relief are, well, not included. So that is Section 504. I'm happy to answer any questions. I can see in the chat there's some already. It wasn't an updated filing, though. I believe it was just a joint statement. I might have misspoken. I will double check. I think that there was an official filing in the court. I think it was joint. I'm unsure. I might have misspoken. I'm not a lawyer either. So, but we work with legal consultants on what's happening with this case. I do believe that there was something officially submitted to the courts that was joint, but I'm happy to double check as well. Shannon said, if it's not withdrawn, I was told by a civil rights attorney that they were successful with the underlying argument here, that the same argument would be used to go after IDA and IDA. What's my opinion? So I'm not not a lawyer, but what they're going after is widespread prohibiting of discrimination when you receive federal funding. I think if the courts rule in favor of these 17 states, it does open the door to other civil rights statutes that are so important to our community. I think the IDEA, I think IDEA is maybe in a little bit of a different boat, as it provides more of a service. It's not the ADA and Section 504, what we call they're civil rights statutes, not regulatory, sorry. They're civil rights statutes, so they don't provide any additional funding, whereas IDEA is a federal program that does provide funding. So I think the future of IDEA maybe is not as connected to this lawsuit, but unfortunately, I think the ADA, the future of the ADA could be tied to the outcome of this. But again, I look at what state attorneys general are saying, and I like to believe that there was maybe just an oversight on signing on to the lawsuit, and they didn't realize that it was going after all of Section 504. We've heard directly from from the AGs that they don't want to take away these services and protections for people with disabilities. And so I think it'll be interesting to wait and to see what the courts decide when it is unpaused. Here in Georgia, our state rep basically said, since a third party site sent them this info to please individual email. Interesting. Thank you for letting me know. I think actually someone on our team was aware of this. I think we got a comment or a DM on social media that was passed to the policy team. That's good to know for future if we're telling people to engage with their with their state attorneys general, that they might get a response like this. And so thank you for bringing that to my attention. And if we have similar action alerts like this, we'll make a note and when we share these on social media or through our website that you may need to individually email these offices. Any other questions? I know I have a good news update as well that I'm gonna move on and share because I know we are running really low on time, but I want to share that there is still good news happening. We're in DC and we're still fighting. We're fighting a lot of proposals, but we're also trying to advance a lot of our legislative priorities. Just this past week on Monday, the Charlotte Woodward Organ Transplant Discrimination Prevention Act was reintroduced. You can see on the side that Charlotte Woodward, she's my coworker at NDSS, received a life-saving heart transplant over 13 years ago. And unfortunately, there's still a lot of discrimination against people with Down syndrome who also often need heart transplants because of the higher rates of congenital heart disease. And so you can use our action alert and ask members to sign on. Currently, it's only in the House, not in the Senate yet, but that's coming very soon. We also have the Enable Act. This extends some provisions of ABLE accounts that are expiring this year. So this is an incentive that gives people who open ABLE accounts an extra $1,000. There's also a provision around that incentivizes ABLE account holders to work. So you can read more and take action on that piece of legislation that's been introduced in both chambers. We have the Words Matter for DC Courts Act. Even though you guys aren't in DC, it's still important for you. It eliminates the R word from the DC court system and replaces it with more respectful language. And then we also have the Eliminating Marriage Penalty and SSI Act that was reintroduced. We also call that EMSA. And NDSC has created an action alert that I've linked here on these slides. And so eliminating the marriage penalty is also a huge priority for us. We think everyone should be able to get married. I personally am a gay man and I love marriage equality. And so once I learned about this, I was fuming. So we need to make sure that we eliminate these penalties. And we'll end
Two
with
things that I want to add, Kevin. I'm so sorry.
No, go for it.
Is because I want good news. I like to spread good news too. Is the organ transplant law that we have here in Georgia is called Gracie's Law, and Charlie and I actually worked really hard to help that get passed a couple of years ago. So we were like one of the first to pass that. So I'm very proud of the state of Georgia for that. And when I first started, I think 8 years ago, we started in Georgia. We passed the I don't remember what it was called, but the R word was also taken out, and all the statutes were fixed to include proper language. So yay, Georgia. So two out of that, that's a really big deal. We'll take it.
Yes,
2 wins for us.
It's always nice to hear good news and to end on good news. And I'll just finish with a reminder that it's really important to continue to share your stories to protect every single federally funded program that supports people with disabilities. It's also really important to note that policy work can get very frustrating, it can get very confusing, and it's super important to take a deep breath and to be kind to yourself. You guys all showed up to a call at 8 p.m. on a Thursday night to learn about what's going on at the federal government. That shows how dedicated you guys are to this community, and it's very heartening for me to see how many people were able to join and listen to me give my little update. And so it's just important to also take breaks, and I know it's very personal for all of us. And so we will continue this fight, and we're all in it together. I mentioned it earlier, but follow us on social media for any breaking updates that are going on Capitol Hill. We usually post right away when something happens and link an action alert and link more information for you guys. and we are always able to answer questions. You can email the general policy inbox. It's policy@ndss.org, or you can send me an email directly. Both of them come to my inbox, so I will respond to either, but Cheryl can share my email with you all. It's also linked on these slides. But yeah, that's all I have, so I can stay on for a couple more minutes and answer questions. I'm seeing some things in the chat.
Can you stop sharing?
Oh, yes.
So I want to thank you, Kevin, for coming on. And I know that this is a lot of information that we just gave y'all, and some good information, some alarming information. Take it however you want or wherever you sit in your own home. We will continue to bring this information. One of the things that I'm actually very excited about is National Down Syndrome Society, the National Down Syndrome Congress, Global. They're all working together because we are all in this together. So it's going to be real important that y'all stay tuned. Like I said, in a couple of weeks, I will let y'all know the date as soon as I get it approved. In the next few weeks, we will be hearing from NDSC, and I'm sure within 2 weeks, we're going to have a whole nother set of issues. So we're trying to keep up as much as we can. If y'all have questions or concerns, if you want to know as much about what's going on in Georgia, I know that Charlie's always available. I'm certainly always available if you want help. I spoke to some parents last night. I had a great conversation with them about how they were going to meet with a representative staff person today. And so we just need to keep that up. Are there any other questions? Does anybody else have anything else to say? I'd love to see y'all on March 8th. You know, making sure that you get all the proper medical information too is really important. So, and we're bringing some top people over here. And so please, I know that Denise shared the link. We will send that out. Can you make sure, Kevin, that you send everything, all your connections and links and all of that to us? So when Denise sends out the recording tomorrow, somebody asked about the recording. When we send that information out, we can put out all the information for March 8th, but please don't miss out on this opportunity. We're literally dropping these people right in your lap, just like we did for y'all with Kevin this evening. So if Debbie Hibben, you have a question?
Yeah, I put it in the chat, and I don't know if Kevin's had a chance to see it or any of the other participants have, and I realize we're late on time, but I'm just curious about how do we approach friends and family who have loved ones with Down syndrome and other disabilities who are not in panic mode and don't understand that, you know, for many of them, the person they voted for is the person responsible for about to have a negative impact on their family, and they don't see it or understand it and are not tuned in. So I realize it's enough for each of us to do what we do for our own advocacy, but I also feel compelled to try to educate others who don't know what we all know that are on this call tonight. So I don't know if anybody in the group has had any success. I'm assuming that the other news outlets probably are giving different versions of the news than what, you know, than what we're all learning from the folks we listen to.
Yeah, I can jump in quickly. I think it's really, again, I'd love to hear that you want to educate as many people as possible. I think that's incredible. And just talk about the importance of all of these cuts and changes in our community. I think what's really important and what I notice is, especially when I have to go to members' offices and I have to talk to them about these cuts when they've made it very clear they support it. Engaging in a fact-based way and also just a calm conversation is what usually works best. You don't get through to people when you're having a screaming match. And it's unfortunate because sometimes you want to scream at people who disagree with you. I know I want to multiple times a day and I can't do it. So I think it's important to just remain as calm as possible. And it's also important to share resources. If you want to take the slides that are sent out tomorrow and share them with people in your life that you don't feel like are in panic mode, you know, go for it. I'm fine with having them shared. And I think it's also just important to like, again, there's people that are not gonna ever agree with you, and that's really hard to understand. And so it's important to also like protect your own mental health and your own peace. I think I've just noticed that doing this work can get very tough and overwhelming. And the last thing I want to do is have you guys feel overwhelmed by how much is going on. I think it is important to maybe not panic mode. I think be incredibly alarmed about what's going on is what I would say. I think I'm definitely in panic mode, but I don't want to overwhelm anyone. I just want to continue to give you guys resources to continue to fight this fight. And I think sharing those resources and just staying cool, calm, and collected as best you can um, is my advice, I guess. I don't think it's the best advice.
I've had the most luck pointing people back to our advocacy organizations rather than news sources. So that's why I really appreciate this opportunity and the information you're sharing. And some people seem to be more receptive to information coming directly from you all with your expertise. So I appreciate this.
Yeah.
So thank you.
Share anything that NDSS has with anyone. Share it as widely as possible. We work very hard on our resources. And so the more people that have eyes on it and the more people that are advocating, the better. So continue to share those resources and also NDSC's resources and Global's resources and GG's and all the Down syndrome groups and all the other disability groups as well. If there's a resource you really like, it's important to share those. And I always love, I work very hard on a lot of these resources, like I said. So having more people have eyes on them is always good news for me. So thank you.
I want to remind y'all that it's what this month is. So it's World Down Syndrome Day, of course, is on 3/21. We're going to be going down to the Capitol. So please make sure more than ever that y'all are going to be down at the Capitol. Bring your kids, bring your siblings, bring your aunts and uncles and whoever else. We want to have a really big turnout. Scott Hilton and Drew Eccles will be helping us with that. Like I said, if y'all are going out to meetings with your legislators, you can either ask me or Charlie or Howie about kind of what to do in that. We have some wonderful stuff coming up in March. Please pay attention. We will all be celebrating all month long. But I also want to point out that NDSS has a great event on April 27th to 30th up in DC. It's their walk on Washington. So you actually get to go meet with whoever your legislators are, your senators. We generally meet with John Ossoff and Raphael Warnock and Hank Johnson. But I've also gotten to meet John Lewis, and I went into Marjorie Taylor Greene's office last time. So you can get heard up there. If y'all are interested in that trip, please you can either contact NDSS directly and Kevin, can you put the information? We've been sending it out.
Yeah.
But it's a great opportunity to really understand. I think that all of us that have been up there would agree that it's a fun time, but you work really hard and you walk a lot. But
Yeah.
it's a really powerful moment to be able to share your personal stories. And so I would highly encourage y'all to go to that. DSAA unfortunately can't do a full scholarship, but we can provide some money maybe to cover meals and such. So if y'all are interested, feel free to reach out. But if you want to have that opportunity, it's a really good one. And they do some great training up there as well. So just let us know what you're doing. The dates for that are in April 28th to 30th.
Yep. April 28th to the 30th. Yeah.
So and we encourage you to bring your children. We have young and old children going. So don't miss out if you can. And of course, DC is always fun. So does anybody else have any questions? I can't believe, Kevin, at our height, we had, I think, 45 people here. I think it says a lot about where Georgia is, and we're really hungry for information, and I want them to get it direct from the people that are out there on the Hill and such. So we really appreciate you coming.
Yeah, I appreciate you setting this up. It's super important. I just put for our advocacy conference, I put the link in the chat, and I will share it when I share my slides with Denise so that she can share it with you guys over email tomorrow. But I hope to see as many of you guys there as possible.
wishing you all a great night and thank y'all for coming, and we'll see you again in a couple of weeks.
Thank you. Good night.
Thank you.
Thank you,
Good
everyone.
night. Good night. Thanks.
Bye, Lucas.